immediately, okay? Thank you.
Good morning, everyone. Hi, this is Nidhi Jyotsana. And today I'm going to talk about leukemia nanotherapeutics. The reason why we are working on leukemia nanotherapeutics is I think we all can very well observe that despite there is a great progress in delivery and systemic targeting of solid tumors like liver diseases, there are still many challenges to treat or to target liquid cancer or leukemia. So just to introduce you a little bit, a dysregulated hematopoiesis or blood production process leads to the development of leukemia, and it happens due to one of these reasons. So considering the heterogeneity among and within leukemic cells in the leukemia patients, there is a great demand to develop novel therapeutics which is specific, stable, and systemic. So in the same direction, we moved forward and we chose CML model, which depends on BCR-ABL fusion oncogene. So chronic myeloid leukemia or CML is a myeloproliferative neoplasm, and it occurs mainly because of the fusion BCR-ABL oncogene, which happens in more than 95% cases of the CML leukemic patients. So in the same direction, we want to investigate the efficacy of, it's not moving forward. Okay. Yeah. In the same direction, we wanted to test the efficacy of lipid nanoparticles mediated siRNA delivery to target CML in vitro and in vivo. So we used lipid nanoparticles which encapsulate siRNA, and the lipid nanoparticles we used, Okay, so the lipid nanoparticles we used are a proprietary mixture of different components, mainly ionizable cationic lipid, which is D-lin MC3-DMA. And the siRNA molecules are packaged in these particles using the nanoassembler instrument provided by Precision Nanosystems. And as you all can see here, that this process of packaging is highly reproducible in terms of the size of particles and also the encapsulation efficiency. Now moving to the next step. Yeah, so what we started, we used K562 cells, which is a human leukemic cell line, which depends on BCR-ABL oncogene for its growth and development. And we treated K562 cells with different concentrations of LNP siRNA formulations. And to our great interest, we could see that even at the lowest concentration of LNP siRNA formulation, we have almost 100% uptake in the cells. And the retention of these formulations inside the cells were up to day 7. Next, to check the functional efficacy of the particles, yeah, so thanks. Next, to check the functional efficacy of the particles. It's really...
No, because I'm sorry, just you have to point to him.
Okay. Okay, sorry. Sorry about that. Sorry, I did not know it. Okay. Now to check the functional efficacy of these formulations, you can see that there is a dose-dependent increase in the apoptosis of cells, as well as there is a dose-dependent decrease in the cell viability in a dose-dependent manner. And to prove and confirm that this functional efficacy is an on-target effect of our formulations due to the release of BCR-ABL siRNA, we could show okay. We could show a significant knockdown of BCR-ABL at messenger RNA and protein levels. So our next aim was to check the efficacy of these formulations in primary human leukemic cells, which are really hard to transfect. And for that, we took CML CD34 positive cells from patients, and then we treated them with the formulations, and we could see a very nice uptake of these formulations in these hard to transfect human CD34 positive cells. And we could greatly see a decrease in the self-renewal potential of only CML CD34 positive cells compared to the healthy cells when we treated them with the BCR-ABL siRNA LNP formulations. And we can see, we can confirm here a differential decrease in the knockdown of BCR-ABL mRNA. So the next aim was to translate our findings in vivo, and before starting a functional efficacy experiment in vivo, we first wanted to confirm a toxicity profile of these formulations in the mice, and to that end, we treated normal healthy NSG mice continuously with different injections or doses of the formulations, but we could not observe any significant difference in the body weight of the mice and the blood profiling, which was also supported by there was no significant difference found in the serum profiling of the mice treated and untreated with the formulations. So next aim, as I told, that leukemia is a disease which generates in the bone marrow, so our target organ of interest was bone marrow. And to our great interest and surprise, we could see almost 100% uptake in the transplanted human leukemic cells in NSG mice when they were treated with 3 injections of LNP siRNA formulations. And more than that, we could clearly see a functional efficacy in vivo, as you can see here that only the mice which have been treated with BCR-ABL siRNA formulations show a significant decrease in the luciferase signal, which is being expressed by the leukemic cells in a short-term experiment after 3 injections, and also in a long-term treatment experiment, which was also confirmed when the cells were taken out from these treated mice, and we did a real time and could show almost 60% knockdown in the levels of BCR-ABL mRNA. So I hope that with this data, we could say that our study serves as a proof of principle for optimized, safe, and specific delivery of siRNA molecules, and maybe it can envision us to further move on in future for the treatment of leukemia patients. And I would like to acknowledge my boss, Dr. Michael Heuser, all the lab members, definitely our collaborators, and all of you for your attention. Thank you. And I'm really sorry about the slide thing. So.
Are there any questions? So maybe at the end, because we are moving. So
okay. Thanks.